Well, May is Skin Cancer Awareness Month, and the Skin Cancer Foundation says 1 in 5 Americans will develop the disease by age 70. Here joining us to talk about how you can protect your skin, especially as we head into the summer, is board-certified dermatologist Dr. Tess Mauricio from the M Beauty Clinic. Great to see you, Dr. Tess.
Great to see you
Thanks
again,
for being
Andrew.
here. Let's talk about skin cancer as far as diagnoses go, because I was reading that it is diagnosed more than all the other cancers combined.
That's correct. That's why Skin Cancer Awareness Month is really important, and I'm really happy we're doing this segment. It's approximated that about 9,500 Americans are diagnosed with skin cancer every day, and every hour there's one person that dies of melanoma. And so, and the thing is that skin cancer is highly preventable, and that's why creating awareness is really key.
Right, so early detection, your survival rate's like 99% within 5 years if you catch it early. So
absolutely.
What does that mean as far as what is early?
What's early is that if you have any new lesion, pigmentation, growing, changing, you really need to go see a board certified dermatologist, because we are trained to spot it, look at it, and then tell you, don't worry about it, or we need to do a biopsy to learn if this is a skin cancer. If it is, then taking care of it, especially melanoma, which is the deadly form of skin cancer, and it can affect young people. You know, if we get it early enough, it really can save people's lives.
So skin being the largest organ in our bodies, a lot of different spots around your body.
Yes.
Is there specific spots to look? Because obviously, is there somebody going to check their skin all the time?
Areas of chronic sun exposure, because we know that UV is really the most common reason why people will get skin cancers. But the scary part is that even areas that are not exposed to sun, can also get skin cancers. And even your scalp, your fingernails, your nails, your toenails, all of those areas. And so it's really important to do a self-check. And if you have a partner who can check your back for you, who can check your scalp for you, and if there's some areas that are itchy, or you're taking a shower and you're feeling something, just get it checked out.
How invasive is a check with a doctor and or a removal? Great
question, because I think that's the one reason. And when we start talking about biopsy, is it scary?
Yeah.
It's really very, very simple. So you come in, and if we as a dermatologist decide that this is a suspicious lesion, then all we do is we inject a little numbing, takes like a second, it's numb, and then we do a biopsy. Usually it's what's called a shave biopsy. We take a little sample of the skin, and that is enough for the pathologist to look at it and then make a diagnosis.
Okay, so what is like a common age for people to really be inflicted with skin cancer, and what is something you'd like to tell somebody maybe in their teens or 20s that maybe they should know now before it gets too late?
Well, prevention is key, and so it's been shown that if you've had sunburns, 2 sunburns when you're a child, that really increases your risk for skin cancers. And so it's very, very important for parents out there to really think about this, to really make sure be out there and be safe. So you want to wear protective clothing, you want to seek shade, you want to apply your broad spectrum sunscreen that's waterproof, SPF 30. So prevention is really where we want to go. But anyone over the age of 18, especially if you have very fair skin, if you've had sunburns, you really need to be high alert.
Yeah, so as far as sunscreen, you said SPF 30 or more, right? How does sunscreen compare to like diet, sleep, et cetera, for when it comes to aging?
Well, it's really good to talk about this, because obviously our immune system is at play here. And so diet, sleep, lifestyle affects our immune system, and of course it affects aging. But you can just compare areas of your body and your skin that's sun exposed versus no sun exposure, and there's definitely a difference. And so other people are encouraged more. It's like, okay, if you're not gonna get indoor tanning and you're not going to get a lot of sun, you will slow your aging.
All right, good reminders. Before we let you go real quick, what's the most terrifying, wildest thing you've seen when it comes to skin cancer that people should know as a kind of a warning?
We have diagnosed melanoma.
Yeah.
And it can look like just a dot, a pigment. And I've diagnosed it on Khloe Kardashian and Julian Lennon, and it can just look like a freckle. And so it's really important too, if you're getting lasers, to just not remove and burn these pigmentation, to make sure a dermatologist looks at it first, because you could be removing the pigment on the surface, but the cancer can still grow underneath the skin.
Really good.
And we're offering a skin check at May 21, and so come in at our M Beauty Clinic in Chula Vista. We're offering free skin cancer screening on that day. Contact the clinic and I'll take a look at your skin.
Dr. Tess, appreciate it. That's coming up on the 21st. More information about Skin Cancer Awareness Month as well, and the free event on our website, fox5sandiego.com, under the Scene on Tap. Thank you so much.
Thank you.
Great information. Good to see you. Thank you.